Hello, my name is Nathan Proudlove. I'm a colleague of Steve and Judith here in the Health Management Group at Alliance Managed Business School. I'm a senior lecturer in operational research and operations management, and I've put together the first half of this Unit 3, leading organisations through process and systems improvement. In this unit, we're going to be exploring how to organise and improve processes and systems. A core theme running through this is quality improvement. There are many aspects to quality in healthcare, in particular clinical quality, so for example patient mortality, operational quality, efficiency, productivity, cost, capacity, etc., and experiential quality, the customer or patient and staff satisfaction of working in the system. In this unit, we're going to be talking about quality improvement and service improvement synonymously. There have been huge improvements over the last 100 years in quality, efficiency, value, productivity, etc., in many sectors. For example, automobile production, agriculture, and so on. So companies like Ford and Toyota have made huge advances, making sophisticated products available at a cost that is affordable to many people. But to what extent has this been achieved in healthcare? Most of us would say not enough. Why is this? Why is healthcare different? Is healthcare different? Why is that translation not happening faster? So in this unit, we're going to be looking at approaches to improving quality developed by many seminal thinkers and refined in industry over the last few decades. For example, Toyota and what's come to be called lean. One of my favourite gurus, who we'll be talking about quite a bit, is W. Edwards Deming. He was a systems thinker and industrial statistician. During the Second World War, he worked with American manufacturers to produce many more bombers more efficiently. After the war, he went to Japan with the American Reconstruction effort and spoke to, amongst others, assembled groups of Japanese manufacturing leaders, including leaders of companies like Toyota and Honda. So in Japan, he spoke to the leaders of many of the leading industrial firms, so Toyota, Honda, etc. They really got his ideas and ran with them and built the sort of companies that started beating the American manufacturers in the 1980s. Also in the 1980s, Deming's ideas were the underpinnings of the first attempts to apply this seriously in healthcare, the US National Demonstrator Project. These ideas then also underlie the core knowledge in the Institute for Healthcare Improvement, which we'll be talking about quite a bit. It's a leading American think tank and a great repository of ideas. And I'll be pointing you to many of their publications during this unit. So there are two sets of fundamental underpinnings to this: systems thinking and operations management. So the first of these, systems thinking, is about understanding and appreciating systems and how they work. As Paul Battledon of the IHI famously said, every system is perfectly designed to get the results it gets. So if your system is producing poor performance or results less than you want, then why is that? Where do we go and look? Do we blame the workers? Do we blame the system? Actually, as Deming said earlier, poor performance in the system, he estimated, was 85 to 95% due to the system, not the workers. So it's the system that permits or encourages poor or dysfunctional behaviour by staff. Think about, for example, a call centre you might have rung up to try to sort out a problem with, for example, a telecoms provider. If the person answering the call is working in a system where they are strongly incentivised to answer a certain number of calls per hour, and you phone up with a particularly tricky problem, how might they behave inside what's rational for their mindset? And how might that actually deliver or fail to deliver what you want, what's value to you? So we need to understand a system, how and why it performs as it does, in order to think about how to improve it. The second set of fundamental ideas come from the academic discipline operations management. So this is a part of any good business degree. It's an academic discipline in business schools, and it's a subject in its own right at master's level. Deming's second theorem was we are being ruined by people's best efforts. He emphasised it's not enough to do your best, you must know what to do and then do your best. So that's why we're digging into operations management. It's knowing about what to lead, facilitate, and enable people to do. So you need to know some of the principles for designing systems, particularly systems involving flow, as many of our health systems do. Flow of patients, flow of blood tests, flow of invoices, etc. It's problems in the flow that lead to many of the issues in systems performance. As Toyota said, the costs are in the flow. If what you ultimately want to do is reduce the costs, you need to understand what's going on in the flow, including quality issues. So this is built on understanding some deductive logic from systems thinking, but also bits of applied mathematics and so on. So there's that deductive academic knowledge. And then there's the inference that's come from decades of testing and refining these ideas in practice in companies like Toyota. So we're going to be taking a practical look at these approaches and how to apply them in healthcare. So approaches like Lean and Six Sigma, model for improvement, and then that forms the top level of a toolkit. Next level down, there's a set of techniques such as the Plan, Do, Study, Act cycle for testing ideas in practice and learning what's good and what's bad about them, building upon knowledge. And at the bottom level, a large set of tools to help us understand systems. So things like process mapping and statistical process control. We'll look at those, how to use them, and lots of examples in healthcare. I'll also give you a bit of an insight into how analytics and modeling tools are starting to be used in healthcare. So for example, things like data mining to uncover potential organizational drivers of performance, simulation to model and experiment on a computer with potential designs of patient flows, and optimization to look at the best organization, the best distribution, best location of facilities. The assignment for the unit will be involving investigating what quality of service improvement there is in your organization, the who, the what, the why, and the how of what's going on, to give us a bit of background and context, and you background and context for your submission. The submissions will be thinking about documenting, critiquing, planning, maybe starting a QI project. So there'll be two pieces of deliverables. The first will be a presentation, which will allow us to understand what you are going to be investigating and give you some formative feedback as well before you submit the main piece of assessment, which is the report. So along the way, through this unit, we'll be encountering some other nice ideas that fit around this. So for example, the role of middle managers in increasing the joy people get from work. That's actually the title of one of the IHI publications I'll be steering you towards. And also how these management ideas might be useful to provide lenses for your wider life as well, outside work, what they might say to you about how you're thinking about your life and your goals, etc. So I hope you enjoy engaging with this body of knowledge and experience, and it brings some value to your work and to your wider lives. Thank you.